Today I'll be discussing multiple sclerosis. Arthur, a 19-year-old university student, was diagnosed with multiple sclerosis 8 years ago. His impairments include muscle weaknesses in his lower limbs, fatigue, reduced balance, occasional numbness in his appendicular region, and periods of blurred vision. These impairments are often more severe during periods of stress or when he becomes overheated. He also experiences cognitive difficulties such as reduced concentration and slower information processing. He often finds it difficult to walk long distances around campus, carry heavy textbooks, and maintain concentration during lengthy periods of lectures and examinations. Furthermore, his participation in university sports and physically demanding employment opportunities is restricted. Despite the impact of multiple sclerosis on his daily activities and participation, personal factors such as determination, resilience, and a positive outlook have motivated him to pursue his goals. He hopes to successfully complete his engineering degree and obtain a meaningful employment opportunity within the engineering sector, improve his physical fitness, and maintain an active social life. Other personal factors include his strong interest in mathematical sciences and his commitment to achieving academic success. Having lived with multiple sclerosis since childhood, he has, to some extent, developed an understanding of his condition and has learned a range of strategies to maintain and manage his symptoms. Nonetheless, he remains conscious of his impairments and occasionally finds it difficult to cope in social and academic situations when his symptoms worsen. For example, during periods of significant fatigue, he may avoid social gatherings with friends or choose not to attend university events. At times, concerns about his physical limitations and physical symptoms affect his confidence and willingness to participate in certain activities. Environmental factors such as disease-modifying medications, physiotherapy services, assistive technologies, including a laptop and lecture recording software, and access to university learning support services have improved his level of functioning, particularly in the academic environment. Another positive environmental factor is the strong support provided by his family, who assist him in managing his condition and encourage him to pursue his educational and career goals. This support network can play an important role in any intervention designed to improve his participation and overall quality of life. As a physiotherapist, my role is to assess, diagnose, and manage physical impairments that affect an individual's movement, function, and participation in daily activities. Physiotherapists work collaboratively within integrated care pathways to provide rehabilitation, support self-management, and improve overall quality of life. As a physiotherapist, I will offer the following intervention plan, which incorporates strengthening, balance, resistance, and mobility training. The first aspect of this intervention plan is strength and resistance training. This training program is particularly useful due to its physiological benefits. Multiple sclerosis damages the myelin sheath in the central nervous system, disrupting nerve signals and causing muscle weakness and impaired movement. Strength training improves muscle recruitment and overall strength, helping individuals compensate for reduced nerve function. Although it does not repair the damaged myelin, it can improve functional physical function. For Arthur, increased limb strength may make it easier to walk around campus, climb stairs, and carry study material. The second aspect of the intervention is balance and multiple training and mobility training. Multiple sclerosis can affect balance, coordination, proprioception, and motor control, increasing the risk of falls. Balance and mobility training improves motor learning and movement efficiency by strengthening existing neural pathways and promoting compensation for damaged ones. For Arthur, this may improve walking ability, balance, and confidence when moving around campus. This intervention will target two components of the ICF. First is body function and structure. The intervention aims to improve muscle strength, balance, coordination, and motor control, which are impaired by neurological damage caused by multiple sclerosis. Strength and balance training may also reduce fatigue and improve overall physical functioning. This will allow Arthur to better control his muscles and movements, allowing him to function within slightly at a higher level. Moreover, it also targets activity limitations. The intervention aims to improve Arthur's ability to walk around campus, climb stairs, carry study materials, and participate more effectively in academic, social, and recreational activities while enhancing his mobility and active and physical capacity. A risk of strength and balance training for people with multiple sclerosis is increased fatigue and temporary worsening of symptoms. Exercise can sometimes lead to muscle weakness or overheating, which may aggravate symptoms. To reduce this risk, I will use a gradual exercise program, include regular rest breaks and encourage hydration and cooling strategies such as hydrotherapy. Arthur would also be educated on recognizing symptoms of overexertion. Another risk is falls due to Arthur's reduced balance, coordination, and lower limb strength. Falls may result in injury and reduced confidence in physical activity. To minimize this risk, exercises will be performed in a safe environment under a physiotherapist's supervision. Support equipment such as handrails can be used, and balance exercises would be progressed gradually as Arthur's confidence and ability improves. Both these strategies are essential because by setting realistic goals, monitoring progress, and involving Arthur in decision making, we can help improve adherence and maximize the benefits of the intervention. As part of the interprofessional team, an occupational therapist would help Arthur participate more effectively in university and daily activities. They may provide energy conservation strategies, assistive technology, and environmental modifications to help manage the effectiveness of fatigue, reduce concentration, mobility difficulties, hand numbness while supporting his participation. The occupational therapist will target two ICF components. Firstly, activities. Occupational therapists help individuals perform daily tasks that may be affected by the condition. For Arthur, fatigue, reduced concentration, hand numbness, and mobility difficulties may impact his ability to study and move around campus. An occupational therapist may provide task modifications, cognitive aid, and assistive technologies to help him complete these tasks more effectively. Secondly, occupational therapists aim to improve participation in meaningful life roles and activities. For Arthur, this includes being a university student, a future engineer, and an active member of the community. By helping him manage fatigue, improve organization, and adapt to physical limitations, occupational therapy can support his participation in study, social activities, and future employment while reducing the impact of multiple sclerosis on his life. As a physiotherapist, I provide specialized care by using evidence-based knowledge to assess and treat movement difficulties. For Arthur, this would involve developing strength, balance, and mobility exercises to address the physical effects of multiple sclerosis, such as muscle weakness, reduced coordination, and difficulties with walking. These interventions aim to improve his participation in university activities and overall quality of life. I will demonstrate the code of conduct by treating Arthur with respect, maintaining professionalism, and ensuring all care is delivered ethically. This includes obtaining informed consent, respecting his right to make decisions about his treatment, and maintaining confidentiality. Involving Arthur in goal setting and treatment planning would also help build a positive therapeutic relationship. Furthermore, autonomous decision making is an important aspect of physiotherapy practice because physiotherapists are responsible for independently assessing patients and making clinical decisions. Throughout Arthur's intervention, I would monitor his symptoms, fatigue levels, strength, and balance, and adjust the program when necessary. For example, if Arthur experienced increased fatigue, I may reduce the exercise intensity or provide additional rest periods to ensure treatment remains safe and effective. A person-centered strategy would be an individualized rehabilitation program involving both the physiotherapist and occupational therapist. This approach focuses on Arthur's goals, including completing his engineering degree, improving fitness, and maintaining social participation. The physiotherapist would address strength, balance, and mobility, while the occupational therapist would provide fatigue management and study support. Together, they can address the challenges of multiple sclerosis while ensuring care remains aligned with Arthur's needs and goals. A second person-centered strategy is a collaborative self-management and education program delivered by physiotherapists and occupational therapists. The physiotherapist can educate Arthur on safe exercise, symptom monitoring, and fatigue management, while the occupational therapist can provide strategies for energy conservation, study planning, time management, and assistive technology use. This approach empowers Arthur to take an active role in managing his condition and being more independent. Given Arthur's resilience and motivation, strengthening his self-management skills may further improve his participation in university, social, and future employment activities. One area of graduate capital that will help me work effectively with Arthur is psychological capital, which involves resilience, adaptability, and a positive approach to challenges. Reflecting on my experiences balancing university, work, and personal commitments has helped me develop these qualities and recognize how they influence the care I provide. This will be important when working with Arthur, as multiple sclerosis can cause fluctuating symptoms that affect his progress and participation. As a future physiotherapist, I will need to remain flexible and adapt interventions to meet his changing needs while supporting his long-term goals. This reflection has highlighted the importance of continuing to develop psychological capital throughout my personal career. Thank you for listening to my presentation.